Before we start this ASMR video, I'd like to thank all these members on my Patreon for their continued support. If you're looking for any content that I create on other platforms, check the link below. Now, let's get into the video.
Hello. You're here for the eye exam, is that correct? Yes. You have come to the right area. I know, I do apologize. The heat is off in the middle of winter, so it is a little bit colder here, but no worries. Seem to have only gotten one glove for myself. I think I left the other one over there. I'll be right back. All right, there we go. Can't do an eye exam without being sanitary, right? Well, I like to pretend that it's sanitary to wear gloves, though. So I always believe that putting on two pairs, well, left and right is what I mean, not two pairs. Anyways. Perfect. So I'm going to be doing that eye exam on you today. Testing your left, right, and left. Whichever one you want to call your right and left. Variety of things to go through. We're going to do light exposure, touch, depth, the whole variety. Starting with, let me pull that one out there. Perfect. Lighting. I've got two flashlights. One, quite a bright one. The other one, not so bright. The brighter one is to look deep into your eyes. This one is to do little frontal portions, just to have a look. So first things first is I'm going to start by looking deep into your eyes from far away. While doing that, I'd like for you to just follow the light with your eyes. And if you can, sort of look past me as you're doing it. It's hard to do when you say it out loud, but you'll see what I mean. So just follow that light. Right to left and right to left. Left to right. Good. Any issues with that? Okay, follow it again for me, please. And again. And again. And again. Any issues there? No, perfect. Just seeing your reaction to your pupils there. Good. Was that hard at all to follow along? No. Okay, that's good. Can you look up for me, please? I'm just going to bring that smaller flashlight in and just have a gander up there. Yeah. Just need to bring your eyelid down. Good. Good. And look down for me. Down and then look up. Perfect. Excellent. Any issues with that? Have you had any double vision lately? No. Good. I'm going to give you a variety of fingers to look at, and you tell me what numbers you see. Just keep repeating the numbers that you're seeing. Perfect. Any issues with that? Any of them giving you double vision? Good. As you look at this light, does it get closer? And as it gets closer, does it become less bright or more bright? Good. Depth perception, no problem. Again, as I come closer to you, does everything get blurry around you or does it stay in focus? Let me know. is in focus? The hand and the light. My hand. Good. Depth perception of your focal blur. That's good. Now I'm going to shine the light into your pupils and then pull the light away. I'm just looking to see the dilation. That's what. Do you see these lines here? Or sorry, these circles. Do you see these circles? Perfect. So what these circles tell you, or what they tell me, is if I watch your eyes go from an 9, from a 9 to this, that means your dilation is going down, or your dilation is increasing. What I'm looking for is when I shine this light into your eyes, your pupils should, that's right, dilate. They should get smaller. Why? The black portion that you see is what lets in light. When you're in a dark environment, they get larger to let in more light. If you have a light that shines into them, your pupils will get smaller because they don't need as much light to see. Does that make sense? Good. So I'm just going to be looking into each eye. As I bring that light in, I'm watching your pupils, seeing what they're doing. Good. That's good. The brighter the light, the faster the reaction time. I could use the smaller light, but I'd rather just look and see how they react. Good. Just follow this light forwards and back. Good. Just follow and back. In and out. Any issues with that at all? Good. What I'd like you to do next, I'd like you to take your finger, touch my nose. Or if you're more comfortable, touch my finger as I move it around. When I move my finger around, I want you to take it, your finger, touch your nose, and then touch my finger to where I move it to. Perfect. So, touch your nose, touch my finger. 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 Touch your nose and finger. Nose to finger. Nose to finger. Nose to finger. Nose to finger. One more. Nose to finger. Any issues with that? No, you did pretty well. So your hand-eye coordination is excellent as well. All right, now that I've done all that, I do have a couple of brushes here that I'm going to need to get a little bit closer to your eyes with. You'd think with all the instruments and tools I would have a better operating system. All right, so this one here, I'm just going to brush your eye off, and then you're going to feel a little puff of air hit it. You can blink, it's okay. I'm just trying to dry your eye out and see how your eye lubricates itself. So, all right, perfect. Okay, let's do the other eye. Good. You can blink. It's totally normal. I'm just looking to see. And good. 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 No issues there. Only doing that twice per eye. Don't want to dry them out too much. Now, this item here, I'm just going to get close to your eye. I'm just going to have your eyelashes, and I'm just going to pull them up. I just want to look underneath your eyelash there, so just stay still. Bring out that flashlight so I can see a little bit better. There we go. There we go. I'll flick that eye up there. Good. Good, good. Excellent. Good. Flick that one up. Look there. Good. Good. And then we'll do the bottom ones as well. Great. And that one there. Good. Can you look that way, please? Over there. Good. Good. Look up for me again. Good, and down. Good, and then look to the other side. Look that way. Good, good. That way, and then down. Look up for me again, please. Thank you. That's great. Good. And then just follow that pen light down. Follow it. Good. And follow the other side. Good. Follow my fingers. Good. 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 Follow. Just check. Good. Down and down. Okay, that's good. 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 That's great. Yeah, your eyes are top notch. Alright, so I'm just gonna cover one eye and I'd like for you to just look at me, okay? Just look at me right there. Look. Good. Good. Can you still see me with that eye? Good. Was I blurry or focused? Okay, and covering that eye as well. Look at me. Look at me. Blurry or focused? Good. I'm going to close both of your eyes with this tool, and then I'd like for you, when I move them away, I'd like to just see how fast your eyes focus. So when you see me and you say clear, then I'll know. So just keep your eyes closed, and here we go. Good. Good. Do it one more time. And good. So I'm looking at your reaction time and how your eyes focus. Is it quick? Is it slow? What that's telling me is how the nerves are working in the back of your eyes, connected to your brain that process vision. Don't worry. You're totally good on that part there. Do you have any questions for me so far? No. All right. Well, I'm pretty impressed with what I've seen so far. Your annual checkup of your eyes is good. I'd like you to come back in 3 months. There's just one little piece that it's not giving me worry, but it's just up there on your eye. That piece, it's not actually in your eyes, just above it. Have you had that for a while? Okay, well, it's nothing to worry about, but I'd just like for you to come back in 3 months' time to have a checkup on it. No, it's nothing that you have to panic about. You're totally fine. Don't you worry. The rest of you, your eyes are in a 10 out of 10, literally. Perfect. So Margaret, just outside the office door there, she will take payment. As you know, her payment system is pretty simple. She likes to get a comment, a subscribe, and a like on her patients' bills. So if you could just do that, she would be more than ecstatic to see you in 3 months' time again. So a like, subscribe, and a comment. She's loving that. And I'll see, well, I won't touch your eyes, but I'll see you in about 3 months' time. Amazing. Perfect. You take care and have a wonderful